Dr. Laster, and welcome to the GI Health Summit. Thank you so much for being here. I'm very excited to talk to you.
Thank you so much for having me. I'm so excited, and thank you so much for sharing your story too, because people like your journey is definitely what inspire me every day. So that's kind of what got me into this. So thank you too.
Well, thank you for those kind words. So, as a gastroenterologist, what does gut health mean to you?
That is such an interesting question that we get all the time in clinic, because it actually has a very complex answer in a lot of ways. Because gut health is a complex interplay of kind of the microorganisms in the gut and the interplay with your gut-brain axis, which also has connections to metabolic syndromes. And if you think about it, we put the outside world into our mouths every day, and rarely do you get sick from a gastrointestinal bug. And that's remarkable if you think about it. We're putting a pathogen in, and our body is so remarkable, it's able to protect you. And that's your gut. Your gut is helping to protect you against all these things that are trying to come in and attack and, trying to break down those systems. So I think of gut health as ways to keep that system and that integrity intact. And for me, being a GI doctor, we talk about poop all the time. So it's having bowel movements every day without having to strain, without feeling that bloating, feeling like you can completely empty. And for people who have no problem with this, it seems crazy, but that is the bulk of our visits, are people who have such issues with going to, things that some of us take for granted, is going to the bathroom. And that is, and having abdominal pain and bloating and chronic nausea. And so those are signs for us as GI doctors is not having adequate gut health, and can lead to some serious issues down the line. So it's pretty complex, and we go through, it's a lot to rule out and, to make sure there's nothing more dangerous or sinister kind of going on and lurking, waiting behind the corners for us. So it takes a little bit of digging and a lot of physical history taking to kind of dig through the weeds and determine exactly what's going on, because it's so complex. But to maintain that good gut health so that, you are skipping and running and pooping and life is great with no abdominal pain.
Well, you mentioned to maintain that good gut health. What does that mean? How do we maintain good gut health?
So let's see. To maintain good gut health, first we'll talk about some of the symptoms people get that's associated with that poor gut health. And what we see a lot in our clinical practice, like we said, is abdominal pain, bloating, nausea, distension. And most times those symptoms are due to constipation, which people don't really put together. We go through a lot of, questioning in clinic to kind of discuss what's going on here. And normally we get down to constipation is a big one, especially in the US. And then we kind of go on to talk about, and typically they think I'm full of it, actually, when I say it's constipation. No one believes that, because I've already presented to the emergency room so many times with this debilitating pain, actually. And they've had multiple upper endoscopies and colonoscopies and imaging studies, and everybody's told them nothing's wrong. But they feel this pain. And so at this point, people's brains, and they've gone to Dr. Google, and they are convinced that, they have this house diagnosis and they're dying, and that we are horrible people that just don't want to tell them that they're dying. So, I typically go through all of these things in clinic, and normally we scale down and talk about in diet, and the medications they're taking. And basically we rule out all the big, bad, and ugly things, make sure there's no family history of colon cancer or inflammatory bowel disease or blood in the stool, weight loss, anything like that to make us think of cancers or that sort of thing. But after getting down to medications and medication side effects, we kind of are able to pin things down. Constipation typically is pretty easy to treat when we talk about changing diets. Americans don't drink enough water, and certainly not enough fiber, which I'm sure we'll get to later. And trying to pin down when this poor gut health started, and trying to understand kind of how we get back to rebuilding or resoiling is kind of what I talk about in clinic with them. Let's talk about it as let's starting over. Let's go back and replant this garden of a good microbiome, to kind of make some improved gut health. And then therefore by improving your symptoms. And then we kind of, just making sure we rule out, make sure they've had those diagnostic tests first, like colonoscopies, to make sure we rule out things like, the inflammatory bowel diseases like Crohn's or ulcerative colitis or microscopic colitis, which are things that could cause constipation or pain, and rule out those medications and change things as we need to. But I think those making sure we get down to kind of the nuts and bolts of the causes of why you're having these symptoms, is kind of the first steps, I think, to determining kind of what your gut health state is, and kind of going from there.
You mentioned that constipation is so prevalent, especially in the United States. I don't know if you're familiar with a doctor named Dennis Burkitt. He was known as the fiber man, and he used to say, if you pass small stools, you need large hospitals. And he said in Uganda, there was no constipation. There was really no colon cancer. Why do you think America is such a constipated nation?
And I think that is so spot on. And I use this all the time. There's so many studies that show the differences in populations, like rural African populations versus Western populations in the US. And there's like absent numbers of colon cancer, and in otherwise similar populations, there's like absent cardiovascular disease. And the biggest differences are the fiber intake. In the US, the recommendations for fiber for women are about 25 grams a day, and for men, 38 grams a day. And the average, according to like an NHANES study, is about that we get like 17 grams a day. It's like deplorable. It's like half of what we're supposed to be getting. And people don't recognize that having a fiber-rich diet is associated with prevention of precancerous lesions, which lead to cancer, cardiovascular disease, mortality, and all-cause mortality. And kind of the reason for that is that fiber has been shown to kind of reduce inflammation, improve that gut microbiome diversity. It also improves the way that you're able to metabolize and utilize energy. So how you utilize calories is based on how your fiber intake. Also kind of changes in alteration of the immune system, how you consume micronutrients and bioactive food products. Of course, it accelerates your intestinal transit time, so you have bulkier stools, so you're able to pass stools more easily. So you don't get constipation, diverticulosis, hemorrhoids, bleeding from hemorrhoids, all of those things. And also the effects that it has for production of short chain fatty acids, which also helps produce this microbial metabolism that's kind of crucial for your colonocytes. And so kind of make sure and that's also that gut lining that we need to protect us. So if you keep your colonocytes nice and healthy, then you're also preventing things from being able to break into that barrier to cause disease and inflammation and metabolic syndrome, which is, hypertension, diabetes. So it's all connected, and fiber is kind of the cornerstone of us, feeling better and having overall better health. But Americans have such a high prevalence of processed foods. So that's decreased fiber, but increase in like the fat and the calories and the added sugars and the sodium and all of these emulsifiers that our gut freaks out and has no idea what to do with these things. So fiber plays a huge role in kind of our gut health. And people worry about protein and people worry about all these other macronutrients, but fiber is the one that is our problem. I've seen very few patients in the hospital with, protein deficiency, which everybody worries they're not getting enough protein. But I've seen the patients that have protein deficiency are patients that are cancer patients that have short bowel syndromes, that are losing protein daily. The average person walking around in America does not have a protein deficiency at all. But I guarantee you they're constipated and bloated and not able to pass stool. So they're fiber deficient. But protein, not really our issue.
Yeah, I have a T-shirt. I wish I wore it. It says "Fiber is the new protein," because you're right. People have been asking me for my entire life, where do I get my protein? And what I say to them is, where do you get your fiber? Because animal products and processed food, which Americans eat something like 90% of their calories from, neither of those categories have fiber.
None. Zero. And people always ask me that because I'm plant-based, and oh no, they're so concerned. Where do you get your protein? I'm like, my lentils and my black beans. It's jam-packed. Trust me, I'm okay.
That is fantastic. So what factors affect gut health?
Ooh, there's so many factors that affect literally everything. When I think of gut health, I think specifically of the microbiome. So there's trillions of bugs that live within us that are, they're living symbiotically. We're working for them, they're working for us, and we have a relationship together. And so your microbiome is being formed even starting in utero. So, and it can be changed and more diverse based on even from your mode of delivery, whether you're born via C-section or vaginally. That's a kind of an optimal time when that head is turning as you come out, you get a nice amount of poop there as you're coming out of the vaginal canal, and you're ingesting that and you're getting a microbiome load, whether you are breastfed versus formula fed, whether you have siblings or not. Because those siblings are in the house bringing a bunch of nice germs and microbiome together to help make your system more diverse. Whether you have pets or not at home, whether you live in the city versus a rural environment. If you were a child that had a bunch of antibiotics, I see a lot of patients that had acne, as brought up. It took a lot of antibiotics for that, or had a lot of sinus infections, and took a lot of antibiotics, and that kind of can wreak havoc on your microbiome. And whether your parents were kind of helicopter parents and they, which is the hand sanitizer makes you wash your hands, or whether they were like my parents and you went outside and you played in the dirt and no one cared. You probably ate a little bit and no one cared. You'll be fine. Whether, depending on what you eat too. So whether you eat a more of a processed food diet, more animal-based products, or whether you're a more plant-based diet, these are all things that contribute to your gut health. Even things like how much you sleep. The optimal sleep is about 7 to 8 hours. People who sleep more or people who sleep less show changes in microbiome. Even stress levels are shown to have changes in the microbiome. Whether you exercise, you see changes in the microbiome. So literally everything can contribute to your gut health. And so when I'm talking to patients in clinic, I often discuss kind of the whole gamut, and they're like, why are you asking me about my sleep? We're not here to talk about that. I'm like, yeah, that matters too. If you work overnight, a lot of patients like nurses that work overnight shifts notice when they changed to those shifts, they started having more issues. They started having more constipation. They started being more stressed. They started gaining more weight. And this is all, they're all related. And when I bring that up, they go, I didn't have these problems until I switched to the night shift. Or they'll say, I didn't have this problem. I just, I stopped exercising a couple of, months ago because I started helping my daughter with her kids and I didn't have time, or whatever the reason is that there's a change. And that's when they start to notice that, oh, now that you mention it, that is when I started noticing I was having more gut problems and more nausea or more bloating or more changes in my bowel habits. And so literally everything can affect your gut health, and trying to just be happy, trying to live as stress-free as we can, which is easier said than done right now, of course, we're all collectively, going through trying to figure this thing out. But, that's kind of the advice that I typically give, because literally everything affects you. The gut is so important. And I joke with my cardiology friends, the heart is only there to keep the gut alive. That's more, it's only there for us. It's only there for my organ. But seriously, the gut is remarkable, and that connection and then that access with the brain and how it connects with your anxiety level or whether you have depression. It really controls how you feel. Whether people come in saying, I feel foggy, and they notice, and once we get down to it, we notice, okay, it's very much associated with bowel habits, with stress, with what you're eating. It's when you notice those things. Or people who have celiac disease, for example, will notice that when we finally diagnose it by endoscopy and labs, they say when they get off this diet, wow, I feel more clear. And I'm like, yeah, it's all connected. So gut health, everything is the answer to that question. Everything affects your gut health.
Well, I did not know that stress, sleep, and exercise or lack thereof affected the microbiome. That's incredible.
Yeah, everything.
Wow. Well, it's not just people think, a stomach doctor, but the GI tract, there's a lot from mouth to anus that could go wrong. You got a lot of territory to cover.
Oh yeah, huge. And people don't recognize that either. They think, it's not that big, not that much. I'm like, yeah, you can wrap your small bowel all around, a football field, as long as your small bowel is. I'm like, it's very crammed in there. It's a lot.
That's interesting. One time I had a Lyft driver who was 29 years old. He had just moved here from Uganda. He had never eaten processed food in his whole life. He said that it's too expensive in his country, so he never even tried it. And he was very healthy. And I'm thinking Americans really grew up eating processed food. They didn't, from birth pretty much after, baby formula, Lego My Eggo, Pop-Tarts. Is it just the lack of fiber, or is there more deleterious effects of processed food for our gut health?
Oh my goodness. I went on a deep dive on processed foods, and like a deep dark hole of trying to understand what was going on in, our country when I saw the prevalence of obesity kind of going through the roof from 1985 to 2014. There's like a famous kind of map on CDC's website that they had to keep adding more colors in because that's how many states were above greater than 30 or 35% of the population that were characterized as having obesity. And so I started to try to figure out, so why is this happening all of a sudden, And then I started noticing, along the same time period, there were changes in industrialization. So we became a more, industrialized country. So things were more commercialized. So that came with, some things that were more convenient. So you were able to get foods from a store in bulk, and you were able to have, we had antibiotics, which was great. But that also came with like the onset of more processed foods and more fast food restaurants. And so then I thought, okay, well, let's figure out when this started or how these, what is in the processed foods in the first place. And I realized to make them more shelf stable and cheaper and kind of more palatable, there are these things called additives, and the most commonly used are emulsifiers, which are a type of additive. And then I said, okay, well, somebody must have approved this to say that, it was safe for us. They didn't just come up with this thing to put in our food. And then I realized like in 1955, yes, there was a committee with the FAO and the World Health Organization that determined, okay, small levels up to 1% is generally regarded as safe, doesn't cause kind of overall problems within health. And then in 1960s, our further US Congress said, okay, well, the FDA is responsible for, additives in the food supply, and they'll, lead the charge for making sure these are safe. And, 30 years later, then companies decided there was an influx of applications, and they said, we need to get more of these on the market. They're super cheap. This is very profitable for us. And then there was, a lot of lobbyist issues because it was slow and the companies wanted this to really move. And they won, of course. And then they just started saying, well, okay, fine. We'll just let the companies send us their data, and that's what we'll use to approve things. And I'm like, well, that's like letting the kid grade their own test paper, but okay. Sure. And then it became that the emulsifiers in kind of the US, like, food supply went from about 800 to over 9,000 in just that period. And who knows, there's not even no numbers of what it is now because it's so ubiquitous. It's literally in your condiments, in your food, like it's everywhere now. So it's hard to kind of even know how much we're intake. And so that's made me think, okay, well, if it's clearly over that 1% mark now because all of our food is processed in some way. And so I started looking for studies, and like someone had to look into this, right? And so there's a landmark study from Ben Chasing from Georgia State, and he looked at two common emulsifiers. One is carboxymethylcellulose, or CMC, and the other one is polysorbate 80, which is P80. You'll see on like the back of things. And they said, well, they tried to look at differing levels of these in water and in food in 3 different strains of mice for 12 weeks. And they were measuring kind of changes in the proximity of bacteria to the epithelium. So that's what we were just talking about how close can the bacteria get to your cells, your inside of you. And typically there's a mucin layer that we have that protects us. And so that keeps that bacteria from getting close, which is why we're able to eat these foods that sometimes have something bad in them, but they don't make us sick. So they also were checking kind of the microbiota changes, if there were any inflammatory changes, if there was any what's called colitis. They would like take their colons out after and check it on gross evaluation, and kind of what we can see on colonoscopy. And so they look and see if there was any inflammation in the colon. They also were checking to see if there was increased fat or fat mass in these mice. If they ate more, called hyperphagia. If these processed foods made them eat more, and if there was an increased incidence of glucose dysregulation. So, and what that would translate to us is diabetes and insulin resistance. And what they found was as little as like 0.1% of these emulsifiers, there was an increase in body weight, increase in hyperphagia, so they were eating more, an increase in a decrease in that layer of mucus that protects us. So, and there's an increase in those little breaks in the mucosa, which they call a tight junction in medicine. So they were more permeable, which means that it was so easy for bacteria to just sneak right in those barriers that we have in place. And then they also show that there was so that led to increased inflammation, which led to metabolic syndrome, which we see in humans as high blood pressure, diabetes, fatty liver, high cholesterol, all those things that are precursors for heart attacks and stroke and early death. And they also saw, what else did they see in the study? Oh, and it changes their microbiome diversity. So I'm thinking, okay, these are things that I see. I know this is a mouse trial. These are things that I see clinically in my patients. This is what we see in these people that are on processed diets. And so people discounted and said, humans aren't mice. You can't use that. And so Kevin Hall from the NIH did a study recently, and it's notoriously difficult to do nutrition studies because it's so hard to control for exactly what people are eating and how they metabolize it and the differences in microbiome. Their energy expenditures is so difficult, especially when they're at home and you're relying on surveys. So he did an inpatient study, had 20 inpatients for 28 days. They were kept in this area. They were able to monitor everything. And it was a crossover study with 10 for half of the study for 14 days. One group was on ultra processed, so all the things we normally eat. Then the other group was on an unprocessed diet. And they were able to match them perfectly for calories, sugar, fat, fiber, micronutrients. Even if they had to give supplements, they were matched perfectly. And they weren't given, it wasn't like a weight study. It was just to see what happens. And so they told them, eat as much as you want. And they measured their daily weights, their physical activity, their energy expenditure, how much they ate. So if they had hyperphagia as well. And then they looked at labs as well, because we weren't going to cut, the humans open to see if they had colitis. So we used markers for that. That's frowned upon in research. So, and what they found was so similar to the mouse study. They saw ghrelin levels, which is the hunger hormone, and this is just in a 2-week crossover study for 28 days. Just in those 2 weeks on that ultra processed diet, they saw increases in ghrelin levels, so the hunger hormone, which made people in turn eat more. So they had hyperphagia. They saw increased weight in those 2 weeks. Increased insulin levels, which correlates to insulin resistance. Increased levels of cholesterol and triglycerides, CRP, which is what we use as an inflammatory marker. So which they were able to see on colitis in the mouse, we were able to see in this marker called CRP. And it just shows that, in just that short period of time, with how ubiquitous these emulsifiers are in our food and in our food supply, you see these changes that relate to your gut health and your symptoms that we see clinically with IBS symptoms, with these changes in abdominal pain and nausea, vomiting, and however yours presents, with constipation, with obesity rates, and then what we often see after obesity with the fatty liver that we see in our clinics. So just from looking at those processed foods, we were able to see kind of, okay, what's happening on a micro level and correlate it to, this is actually what we see clinically. And it's pretty remarkable when you can, coax people into getting off of this diet for just a little while. Then they start to notice, wow, I did sneak, they're going to sneak. So it's great when they do, because then they say, I never knew I was feeling that way because I was so accustomed, that was my normal. So when they have a day when they snuck to do back to their normal diet, they notice they feel crappy and they get that blood, they get those feelings back that was normally their baseline. So it's been seeing all of these studies and this new data come out about emulsifiers and microbiome changes and us being able to see those changes. It's very interesting, I think, for the future and for us to do kind of more precision medicine too and precision treatment for getting people to figure out what diet works best for them, and it works best for kind of their symptoms too. So yeah, the processed foods they're everywhere, they're in everything. And once you become aware of them, it takes a lot of paying attention to the back of your labels when you're purchasing, when you first, decide it's going to be important for you. Because it's hard because it's almost everywhere. So there's only certain brands of like almond milk that I drink, because all the rest of them, you'll see the carrageenan and all of these other emulsifiers. And it's a difference, because I'll even notice if I go to a coffee shop and they put the wrong type of milk in there, I'm like, I feel it immediately. I'm like, okay, great. There was something that was not what I asked for, clearly, because I feel it. So it takes some work, but once you start to pay attention to, what's in these processed foods, you start to really see the correlation with how you feel. And the science is proving it. The science is there now. And yeah, they wrote off the mouse studies, but when Kevin Hall's study came out, it was like, okay, this is a small study, a small group of people, but you really can't argue with that correlation and how closely that mirrors the mouse study. So yeah, I try to harp on processed foods a lot, which is difficult because it's like you said, we've been eating them for, your entire life. So, and just like we talk about the microbiome being a symbiotic relationship with us, I always joke with my patients. They say, I can't live without, a soda and like my Doritos. People love Doritos. And say, I'll give you that. And it's, you probably do feel like you can't live without it, but it's your microbiome that wants to survive, that thrive off of those those Doritos and Coca-Colas, and they want to live too. So they're making you feel like you can't live without it. So you're not totally off when you say, I feel like I can't live without it. It just takes a little hump to change the microbiome so that you don't have those cravings anymore. So it's funny when you kind of tell them what's going on, I find by talking about the science a little bit, not to the point where I bore them, but to the point where it starts to make sense a little, that they say, okay, that does make a little bit of sense. And if I change this a little bit more, I'll start to crave this more. And so I'm like, yeah, I used to, crave, a soda, especially when I was on call. That was my free time. If I was on call for, overnight and it was my 28-hour shifts, it was my license to like eat whatever was in the nurse's station. And, I'm thinking, I said, well, yeah, you start to crave those things. And once you stop it, I'm like, I can't tell you the last time I had a soda. And I don't want it at all, but I crave water. And then like, oh, I don't want water. I hate water. I'm like, you won't. Trust me. Just give me some time. So processed foods.
Yeah. That's funny. I can tell you the exact last date I had a soda. It was Sunday, July 6, 2003.
Wow. That's awesome.
Yeah, because I was checking into the Optimum Health Institute because eating processed food. So even though I had been vegan for 26 years, I was a junk food vegan, and I drank tons of Coke Slurpees and Dr. Peppers. And I actually got up to 200 pounds and had the beginning of colon cancer. And I remember the exact day that I stopped soda and caffeine and sugar and flour and all the crap. And my life has been so much better without processed food. It's incredible.
And I tell people that part too. I'm like, they're like, well, I'm a vegetarian. I'm like, you could eat Oreos and Doritos all day and be a vegetarian. You understand this, right? I'm like, it doesn't, like all of these like vegan junk foods that are out there, chocked full of processed emulsifiers and things to keep them shelf stable and to look pretty and to make them taste palatable. I'm like, so they're just because it says vegan or because it says vegetarian doesn't mean that it's necessarily healthy for you. They're still processed foods. And, it's hard to beat into people. I just want you to eat something that came from the ground, that, something that your grandmother would tell you was okay for you to eat. So your grandmother was right, basically.
Yeah. Well, thank you for saying that. It seems like the more our country has increased the consumption of processed food, the worse our health has gotten in general, and our GI health in particular.
Yeah. And, it's remarkable when you're taking out polyps of people that are younger than you. It's scary, It made me, all of my fellows, I remember when we were in training, we all joked that we kind of wanted to just get a colonoscopy before we finished training just to be sure. Because when you're taking out polyps out of 25-year-olds, and we normally start screening at, we changed it now, but it used to be 50, but now it's down to 45 because of this, which, when I'm seeing 30-year-olds with no family history of colon cancer that have polyps and precancerous lesions, it's like, what are we doing? Where
Yeah.
so we has to stop. We have to get this message out. People have to understand the correlations with red meat and colon cancer, with, these processed foods, this lack of fiber in our diets. And it's pretty remarkable when you start to, and it's funny that you said that, when you knew you had those precancerous lesions, you said, okay, it's time to turn this around. And I wish more young people would understand that as well, because it was definitely a wake-up calls for us, being in training, to see people that, were 30 years old with, colon cancer with no family history. So not people you would, necessarily have on your radar to be concerned about. If you have a family history, then yes, you're already on the radar. We know to worry about you. We know to get you in for screening. But like your average 30-year-old who's, eating pizza and hanging out and, drinking, Pepsis and, all the processed diets, you really weren't as concerned about. And turns out when people come in, I have a higher, suspicion with everybody now, because if they say they're having some blood in the stool, I'm thinking, okay, you can't just automatically say it's hemorrhoids or diverticular. You have to think about it, because I've seen so much colon cancer in young people. And a lot of it, I think, is due to our diets and low fiber diets and processed foods and red meats and all the meats that we eat. So it's incredible to see, and sad,
It's incredible. I almost feel like the way cigarettes have the warning label from the Surgeon General, we almost need to put that on meat and processed food as well. Like,
Exactly.
consume at your own risk.
Yeah, and I read in like a magazine, it was like a little quip, but it was saying, people will not smoke in front of their children, but they'll send them to school with like a bologna sandwich. And I'm like, yeah, that's really true. And I remember my mom, it's so funny. So I used to get so angry with them because I wanted to go on field trip with a Lunchable like everybody else. I just really wanted to be able to peel that little Lunchable back. I thought it was so cool. And I never got these processed things for my field trips. And I thought they were horrible people. And now I'm recognizing like they were trying to protect my gut health. Like, thanks, parents. You were trying to do what was right for me. Sending me with an apple thought you were being, mean parents. But it really starts to build that microbiome early and build kind of what your children have a taste for and kind of what they grow up to eat, and changes their gut health remarkably in the long run.
I wish that's one of the things that I've been standing for years, is just to let people know what they eat really matters.
Yes. Oh, yeah.
It's interesting because when people go to the doctor, they almost always get their blood pressure taken. They can assess their cardiovascular health very easily, non-invasively, or if they get a blood test, they can assess their A1C, looking for diabetes or inflammation, things like that. But it almost seems like with gut health, unless somebody is going to have, a procedure, there's no kind of screening for gut health. You know what I mean?
Yeah. And that's true. And that's because the science isn't there just yet to be able to give us a way to reliably screen. So there are there's those tests that you'll see out on the markets that test for your microbiome and your stool and that kind of thing. And the problem with those are we don't know what a healthy microbiome is just yet. And so we don't know what to do with that information and that data. And so those things are expensive, and it's just like to say, okay, well, here's what your diversity of your microbiome is, but we're unable to do much with that. So I think that's the problem with being able to determine kind of gut health in that sense. I think in some ways you have an idea from a history, from like a review of systems, what somebody's gut health is. I think the problem is implementing it in practice. And I think another problem is time, because it's kind of the heavy lifting to talk about diet and dietary trends, and kind of because it's been long standing. And so it's a little bit more difficult, and it's not something that's it's concrete as a blood pressure. And is normally waxing and waning, and people don't think about it. And they definitely don't correlate it with their health. Usually, it's normally us putting that together for people to say, you do reckon. And I had a patient that told me one day, she's like, I keep getting abdominal pain every time I eat. I said, well, when you eat what? And she goes, well, when I had Panda Express, I had abdominal pain. When I had Wendy's, I had abdominal pain. When I had Taco Bell, I had abdominal pain. And she didn't correlate the fact that it was when you were eating these fast foods, they were all greasy, high fat foods. And after she got, I'm like waiting for her to, say, oh yeah, no. And so some people don't correlate it. They think I've been eating this way my entire life. So why is it bothering me now? And so I think that's the kind of the problem. That is, food is one of those things that you have to eat to live. You don't have to smoke to live. You don't have to drink alcohol to live, So those are things that are easy to kind of get people to stop. But trying to breaking the habit for food and eating, trying to break the lifelong cultural habit most times of that's deeply embedded into how your entire family eats and what you eat at family occasions and, and holidays. It's hard to break a cycle of that being a tradition in a sense. So I think that's what makes gut health more difficult. And nobody talks about bowel movements. People get even freaked out and talk about a GI doctor. I'm like, they're like, I don't, it's a little embarrassing. I'm like, there's nothing embarrassing in here. We talk, just say it. If there's blood, like whatever there is in the GI doctor, we can say it. It's no big deal. We have poop jokes all day long. That's what we do.
That's one of the reasons I want to do this summit. I want to make people understand it is normal to poop. Everyone poops.
You want to poop. Trust me, it's great.
Yeah. making pooping great again. That's my mission. Yeah. It's interesting because I've interviewed some dermatologists, and they recommend that adults go once a year to a dermatologist to get a skin check, even if there's nothing wrong. Yet we really don't go to a gastroenterologist until something is already wrong.
That's so true. It's so true. And people, another problem is when people do go to the gastroenterologist, by the time they finally make it to see us, they also just want a pill. They're really upset with you almost if you don't, have a magic pill to make, everything go away and to be perfect again. And it takes a lot. And that's why I think the heavy lifting comes in and why a lot of people don't do it as much, because it takes, a lot of follow-up, a lot of talking, a lot of, getting down to and getting people to buy into it almost, to understand and agree with you. You have to prove to them in a sense that all of these things, you're not dying. All of these things are okay. These are things we ruled out. These are things that we would be concerned about, but we don't have to be anymore. And now let's talk about the diet, because people will, assume that you're a crazy person and you are, not this person they think is constipation. Of course, it's not what it is. And then you have to also have frequent follow-ups. So I'll get people, to buy on finally. And I'm like, okay, just give me 2 weeks, please. Give me 2 weeks. Just, you can think I'm crazy this entire 2 weeks, but give me 2 weeks. And then when you come back in, it's amazing. And they say, you know what? You were telling me I was going to think you were crazy. And that's what was going through my brain. I thought you were crazy. And when they come in, they're like, I can't believe it. I cannot believe that I feel better from going to the bathroom. So people actually do not correlate this bloating and nausea and abdominal pain. They really don't believe that it's associated with constipation. Whereas like, if you think about it, you don't, and you don't feel like eating if you're quite literally full and you're distended because of stool that's just sitting there and you don't eat fiber. So it's not having great transit. So it's sitting and causing stasis and basically just sitting there fermenting, causing more gas, which is why you're getting more and more distended. And yeah, if you're distended, you're going to have nausea with all of this gas. So you're not going to want to eat. And yeah, that's painful and it's going to be painful when you finally have to go as well. So, and it's when you finally describe it that way that they sort of say, oh, well, okay, maybe I'll believe you. They you got them by 40% at that point. They're like, they're following you maybe. And then when you finally can get them going again and they decide, I think you're right. A guy, his wife, and she had been complaining to the husband apparently this entire time about how horrible, and he's sick of it. And during the visit, he's in the corner and I see him looking, just basically giving me the evil eye of, this lady is crazy. No way, but my wife just has a bowel movement. She's going to stop complaining. And he's this huge guy. He's 6'4" and huge. And he comes back in with his wife the next visit. And the first thing he does is give me a hug. And I am in shock. I'm like, you hated me last time. I could tell by the look in your eye, you wanted to kill me. He goes, I didn't believe a word you were saying. He goes, but I finally got her to stop complaining. He goes, I can't believe it. I've had a peaceful 2 weeks since we saw you. And then we all had a big laugh about it. So it was hilarious. But it's that heavy lifting part. I think that our practices are so busy. We're forced to do more with less time. And it takes time to have that conversation and to get to that root and to get people to buy into what you're saying. So people give up because they've had these problems for so long. They say, whatever, this person's crazy. I'm not going back. I'm not doing what they told me to do. I'm going to continue. I've been eating this food for 50 years. Why should I change now? I never gave me any trouble. So it's a heavy lifting. I always tell people it's easier for me to have a patient with inflammatory bowel disease, which is a much more difficult diagnosis and much more complicated. But I have a thing to say, this is what we can fix and what we can do for this. But whereas with IBS and constipation, it's more abstract and it's more us finding what works for you. And so everybody in GI will say, those other patients are much easier because you have a kind of an algorithm exactly what's going to work for them. Whereas it's kind of finding what works and trial and error in the other patients, and no one wants that. They want something right away, and if you don't give something right away, then they give up super quick. So I think that is the hardest part for sure.
But it sounds like in addition to fixing people's guts, you're a marriage counselor too.
He joked and said the exact same thing. He goes, "You fix this. I don't want to kill her anymore." I'm like,
that is terrific.
Hilarious.
You mentioned that some of your patients say, well, I've been eating this food for 50 years, so why should I stop now? I don't think people realize that the damage to the gut, that it's cumulative. Like nobody gets lung cancer. Well, I don't want to say nobody, but usually it's not from smoking 1 year. It's smoking 50 years. But with foods, they don't understand that it's progressive and cumulative, the damage that these foods can do to the gut.
Exactly. And it's over time. And you've changed this microbiome, and you've changed it to such a setup and such an environment that it's just more and more inflammatory changes. And no, you didn't have fatty liver the first year that you started eating this way, but it's taking you years to get fatty liver. And then fatty liver then turns into patients having cirrhosis. So this is the first time in like history that we're starting to see more patients need liver transplants from cirrhosis due to fatty liver than from hepatitis C or from alcohol. Like it's crazy. When you think about that, we're literally eating ourselves into having cirrhosis and having to have liver transplants. And then the first thing they say when we have these little ladies that come in and their family are like, well, she doesn't drink. How could she have cirrhosis? And it's describing and explaining to them, well, likely this came from the fact that she has metabolic syndrome. She has excess weight. She has high blood pressure. She has diabetes. They're all set up for metabolic syndrome. And typically you have fatty liver as well. And over time, that inflammation in the liver, your liver poops out and it says it becomes cirrhotic. And then you have liver failure. And only thing to do to treat that is to give you a new liver. So it's pretty remarkable that that's what we're seeing more of now is people requiring liver transplants simply from a progression from fatty liver. And that has come from excess weight. And so when we see a lot of appointments for people having kind of an incidental finding of fatty liver, so they've gotten a CT scan or ultrasound for something else, and then they've seen this fatty liver on imaging. And so I try to, give a little bit of a scare when we talk about it because they don't feel it. It's not something you feel, right? You don't feel particularly bad with fatty liver. Nothing else is going on. But, I try to let them know, like, this is a real risk that over time. And so if you're only 40 and you already have fatty liver, then over 10 years with this inflammation, 15 years, by the time you're 55, 60, you could have cirrhosis and need a liver transplant. And it's not a fun time. And so I described to them what, end-stage liver disease means, because when you don't see these things in practice, almost like COVID, when you're not in the hospital and seeing what we see, then it's out of sight, out of mind. But when you're vomiting blood and you've seen a family member that actually starts to vomit blood due to cirrhosis and varices that you can get, it's traumatic. And feeling that bloating, which is the ascites, and not being able to breathe because you have so much fluid in your abdomen, and it becomes, it's a big deal. And I think people, they don't see it, so they don't think it exists, and they don't understand like the progression. So it's life-changing. And I think when the people that get it and decide, oh no, I don't, or they've seen somebody with cirrhosis, then they say, oh no, I'm not going down that path. I am getting this together. And and we don't have a pill to treat your fatty liver. All I can tell you to do is, what I know from the literature is if you lose 5 to 10% of your total body weight, you come back in, we get a repeat ultrasound and it's gone. Because I'm like, that's all I can tell you to do. I can tell you how to get I can give you a diet plan. We can talk about what you're eating. I can help you there, but there's no like magic wand I get to wave to get rid of your fatty liver. So I think that this processed food and kind of the diets we're eating are, it's all linked. And that's the thing. I think people don't understand that this food, even though you've been eating it for a long time, it's all linked.
Yeah. And, I knew somebody that actually did get a liver transplant, and it's not like they're just handing them out.
Yeah.
There was a long wait. It was a really intense operation, and it's, but I think a lot of people would rather have a pill or a procedure than change their diet.
Yeah, 100%. And that's the hardest part is it's getting people to buy on to, we don't have that, we just, that doesn't exist. There's nothing magical that we have. And I think the other thing is us it's a cultural thing. We have to all start to buy in that we have to eat better. And even that's all connected with, our environment, with our climate, with soil health, with, the air we breathe, the water we drink, like it's all connected, our farming practices, the food waste, like everything is all connected. And the more that we get, away from so much animal-based products, the more we get away from, the way we've done this farming practice where we're cramming all of these animals into one place and we're giving all these antibiotics to animals. And then we in turn eat those animals and we wonder why there's antibiotic resistance. And we're having all these people in the ICU and we're running out of drugs to give people. It's all a cycle, and the more we get that message out and people start to understand that, the better. That everything has a consequence. And if we stop using all of these fertilizers and pesticides and all of these things, then we'll start to see that these, our health will get better, and our environment will be better for our health as well.
Well, I think there is one thing magical, and I think that is fiber. True.
Fiber is the one thing that we could definitely do to increase our gut health. And that's in people, and it's all about getting more beans, more legumes, more grains, more fruits, more natural fiber. People also just want to take a fiber supplement, rather than just eat the fiber. So and that's what kind of we preach every day. I'm like, I'm not going to tell you to count calories. I'm not going to tell you to do any of these things that I think are too difficult to maintain. I think it's more about getting more whole foods, getting things that are in its real natural state, that's unprocessed, and eating an actual apple rather than having like an apple sauce, or that you've got from the store that has, caramel drizzle and whatever other thing they put in it. And getting people to get back down to kind of just simple eating. I mean, and they almost believe that it's too simple when we talk about it. I'm like, but it's really that simple. I just want you to eat lentils and onion and garlic and Brussels sprouts and, just a little bit of quinoa, and just to eat actual food.
Yeah,
things
exactly.
You recognize, things that where if it can come, I tell them if it can come from the earth, if you can pick it from a tree or see it from a ground, we should eat it. And eat, and it's only, and I'm like, eat it. How much should I eat? I'm like, eat as much as you want. There's only so many apples you're going to be able to eat. I promise you. You're not gonna gorge yourself and gain weight because you've eaten too many apples today. I don't think that's going to happen. So that's one of the things we talk about a lot, and just trying to give them as much data as I can on it to kind of change their minds about it. There was this recent study about byproducts of animal that get broken down by your microbiome. So people who ate more animal products, they had increased outputs of TMAO, which is trimethylene N oxide, which has been associated with increased cardiovascular risk and atherosclerosis. And so people that had increased diet in animal products their microbiome was such that they had this as a product. But patients that were plant-based, their microbiome was such that even if they had a 1 day of this animal-based product, they did not create the same TMAO byproduct. because their microbiome was just not such to even oxidize it. And even they showed the same thing with giving people antibiotics. So that made us understand that it was associated with the microbiome itself, because if they wiped out the microbiome with like this broad spectrum antibiotic, you still didn't produce it. Although that changes, of course, as soon as you start back eating normal, that real regular food again. But just trying to give people these little bit of pieces of information to prove, because the nutrition data is all over the map, and what people, get online and say it's healthy, and what, the keto group and the paleo groups and all, the gluten-free groups, and, everybody has a thing that they're kind of pushing. And my message is always, no, we don't have to do any of those things. You don't have to worry about trying to stay in the keto phase. And all these things they're not able to adhere to them. They're difficult to withstand. They don't actually help with your gut health most of the times. If you're eating all these animal-based products, you may lose weight, but you're not helping the end game. And the end game should be your overall health. I don't want you to have a heart attack. I'd rather you can be skinny and have a heart attack because you have all of your vessels are chock full of plaque from all the animal products you've been eating. So I'm like, okay, those products are great if you just want to lose weight and you don't care about anything else. But I would rather you be able to have bowel movements every day, have a normal microbiome, and to be able to not have colon polyps, colon cancer, and to decrease your risk for stroke and for heart attack. That's one, and I try to get that across, is that should be our goal, not just, the weight loss. Yes, I want you to lose weight, and you're going to lose weight. If you eat this way, there's no way possible that you won't lose weight.
I so appreciate that this is your focus, because so many doctors in general, and even some GI doctors, think that what we eat just doesn't matter. And how could it not matter?
And that's sadly an outcome of our training, because there's so little focus on nutrition in medical education. And then by the time you become a resident, you're working 80, 120 hours a week. And your focus is on keeping the patient alive and, getting through the day, getting through those codes, getting through those notes. And that's not, and I remember during my, when I was doing my nutrition training, and I was thinking back to being in the ICU, and when the nutrition therapist would tell us about, what the rate should be, and how I just wasn't paying any attention. It was about, all about, where there's sats on the ventilator, how many pressors do we have them on? Are we able to come down? What's their white blood cell count? And this is like kind of just what is drilled into you. And it's not, a focus isn't put on. And now I think about it, I'm like, it was very important to make sure they were on these 2 feet to maintain their gut, health, because the inflammation is so great when there's a septic shock. And maintaining that gut health is going to be beneficial for them in the long run, and getting them off the ventilator. And these are just not things that are, emphasized throughout your medical training as much as it should be. And I think it's kind of perpetuated because it's not emphasized during medical school. So of course, it's not going to be emphasized during your residency either. So me and some colleagues are trying to change that because we've done some talks and people are actually getting more interested. So trying to change that trajectory of people talking about diet and seeing that it does matter. We should, as doctors, you should know the data. This is our lane as well. And, we should work more closely with our dietitians and our nutritionists. And there has to be more collaboration for us to help patients. Even if we can't do it all, we should be able to start the conversation. And I don't expect everybody to do a nutrition fellowship like me. I just love it. But I expect that you should be able to have a baseline knowledge, and you should know what the importance of that relationship with our dietitians and nutritionists. And that way, and if you see the importance, then the patient also sees the importance. They'll actually go and follow up. So I think it's definitely a problem in our training, which, gets carried on into how we treat patients and why we just give people, medicines a lot of the time.
Yeah. I volunteer at a hospital, at least I do when we're not sheltering. And it's incredible the food that they feed the patients and that they serve in the cafeteria. You wonder why more people aren't actually in the hospital. And even some hospitals have McDonald's in the lobby.
Yes. It's deplorable, actually. it's really unfathomable that that would be what we're feeding people. And sometimes we put in a particular diet when people are inpatient. This is the diet they should be on, and this is what you put in the computer. And sometimes you go to the room and you see the tray that they brought them, and you're like, this is not a heart healthy diet. This is not a low salt diet for this renal patient. This is not a diabetic diet. And so it's a lot of that has to do, it's, above us too. It's a bunch of contracts that are done through the hospitals that, we don't have a lot of a say in. So that part is, I think, another part of the broader picture too, of us understanding kind of how all things they all work together. And if we're going to change patients, the reason they're in the hospital sometimes for heart failure, we're telling them how to eat better. And we have, the dietitian speaking to them every day about their daily weights and their intake, but yet we serve them a thing that wouldn't be on that list. I think that's a big thing we have to start to change. And we're seeing it in some, like one of my friends' hospitals in New York and Cornell, they have like a beautiful plant-based, options in their cafeteria. And I was like blown away, like, wow, this is amazing. And when I was at OHSU during part of my nutrition fellowship in Oregon, I'm like, wow, this is impressive that this is your options in the cafeteria, because it's just not, most of the time, like you said, there's a McDonald's and a Taco Bell and some, all in the lobby, which cannot tell you the last time I've eaten that. Probably maybe college is like last time I ate McDonald's. So yeah, that's another problem in our awesome healthcare system.
Yep. Unbelievable. So you mentioned there's so many things that can be detrimental to the microbiome: poor sleep, stress, antibiotics, meat, processed food. I forget what not exercising. What is going to help our microbiome? Can we improve it? Can we change it?
Oh yeah, there's been plenty of studies that have shown that we can most certainly change your microbiome. And it can be changed quickly too, even within a week, just simply changing your diet. So some of the things that I recommend are, first, I tend to start a little bit slowly with certain people, getting off sodas. It's incredible how much soda a lot of people drink. It blows your mind when somebody can say they drink 2 liters of soda in a day. So getting people off soda first and increasing that water intake, getting them off those sugary beverages, and then tackling those processed foods and decreasing how much fast food and, microwavable foods that people are eating. And then slowly increasing, I get them say, okay, if you could just give me 1 real fruit a day. And then we slowly get to 2 real fruits a day. And then, can we get some beans a day? Can we get, how many vegetables can we get in a day? Because some people, they say, oh, I don't eat vegetables. That's not uncommon for me to be in clinic. I don't eat that. And I'm like, or I don't drink water. I'm like, you are water. What do you mean you don't drink water? But it's very, very common. People,
wow. It must be so frustrating. I can't imagine.
And it's saying the same thing kind of over and over and over again, and being kind of shocked. I'm not shocked anymore because I've heard it so often now, but people that literally don't eat, fruit, don't eat vegetables, and wonder why they have poor, overall health. But getting to, and that's how I slowly start getting people back to a better microbiome, is initially starting with, liquids are always easiest, and then slowly getting them off of, junk foods, and then slowly off of the fast foods, and then slowly creeping in at the same time, increasing their actual whole foods intake. And then trying to work, so many people are like meatitarians, as one of my friends calls himself, but trying to get them to get off of so much meat and kind of have meatless days. And I use some of the blue zone populations as some of my evidence there, and tell them, as we get older, I think some people think that as we get older, that it's just a rite of passage that you get high blood pressure and diabetes and high cholesterol. You take these pills and you spend your, 70s and 80s just shuttling around to doctor's appointments. I'm like, that doesn't have to be that way. Actually, we can change that reality. And the blue zone population shows us that. And those are populations, 5 populations across the world that have the greatest population of people over 100 that have active life years, though, that are still hiking, that are still working out, that are still cooking, that are still driving, that are still hanging out with their friends. And that's part of their lifestyle, is they eat mostly plant-based. If they do eat meat, it's about 4 to 5 times a month, which most people eat meat, for every single meal from a day. So that's a big change for them. But I'm like, those are things that there are all the things that we talk about for improving your overall health are what these blue zone populations ascribe to. They believe in having a higher purpose. They believe in kind of social aspects of life with their family and their loved ones. They believe in kind of being there for one another to decrease their stressors. They believe in purposeful movement, so exercise and walking more, whereas some people will drive around to find the parking spot very closest. They believe in just walk. It's okay to just walk, take the stairs and, walk to the store rather than drive to the store, and getting adequate sleep, but also having fun. And so getting people to stress less and just try to, embrace life and have some fun, I think are ways that I try to get people to improve their overall health, but but at the same time, their gut health. That's kind of simultaneously. So I'm a doctor prescribing fun, and joy.
With a lot of these GI issues, it's not a quick fix. So do things like probiotics or fecal transplants, can that help people get better faster?
That's a good question. So people like we say, people always want something quick and easy. And the problem with probiotics there are many actually. There's so many on the market, and they aren't one size fits all. You never know what the bioavailability is going to be by the time you get into your gut, where it actually counts. And so that part is very difficult, and there are very few trials on which ones were actually beneficial. And so the ones that we would recommend the most would have been Align or BSL-3 or Culturel. But there's actually recent guidelines by the AGA that showed that there just wasn't enough data for some of these uses. So even for IBS, there wasn't enough data for even with people with recurrent C. diff, which is an infection of a stool infection, essentially. And the only treatment that they saw it was useful in patients that had what's called pouchitis after having like ulcerative colitis and being reconnected. They saw it was useful in that population. And then in people that have been on antibiotic treatment. But otherwise, in the things that we were using it for, like in IBS patients or in patients with recurrent C. diff or people with acute infectious gastroenteritis, basically the data, there's not enough to tell us that this is actually useful. And most certainly, the ones that we see kind of run of the mill on the shelves are not things that are particularly probably going to help. And also I tell people it's when you're trying to resoil, you can't eat Doritos and take a probiotic and think that that's going to cancel each other out. It's all about resoiling completely and changing the entire your diet so that you can change the microbiome itself. So no, probiotics are also, again, not a quick fix to ensure that you're going to have this, A+ microbiome. If there's not shown to be a lot of data that they're necessarily harmful in the average person. But if you have severe disease or somebody has, problems like small bowel problems or inflammatory problems, we have to talk to their physician about them before using them. And fecal transplant is also interesting. We use fecal transplant in patients with recurrent C. diff. There are studies that are ongoing to look for their implications for other diseases. And actually, we did a study of our experience when I was a fellow at Georgetown about what the implications were in inflammatory bowel disease. So patients with inflammatory bowel disease have an increased risk or susceptibility for C. diff. And they're also sometimes more difficult to treat with the standard treatment. So they often will undergo fecal transplant. And we also would see in some of those patients that had pretty severe inflammatory bowel disease that we would see a change in their treatment in their kind of trajectory of their inflammatory bowel disease as well. And so we started to think, is this somehow also helping that as well? So because we did see that they had less flares. And it was like, okay, is this the chicken or the egg? Is it because we're treating the C. diff, or is this also changing their microbiome in such a fashion that it's also helping in the treatment of their underlying inflammatory bowel disease? So that part is quite interesting. And the problem, we just don't know enough about fecal transplant. Because there's been case reports that, because initially before we started using like a lab, we would have loving family members to donate stool. And we would have them come in and check their, to make sure they didn't have any other infections they could also pass along. But then they would get a lovely blender and some instructions, and we have them blend their stool down, and we would bring it's amazing. And we bring them back in and we use their stool to implant into their loved one. Because presumably they should have a similar-ish microbiome if they live in the same household. And so, but one problem is before the screening of the stool was so strenuous, there was a case report that a lean woman had obtained the stool of a patient with obesity. And the lean patient that obtained the transplant started to gain weight after the transplant. And they researched it back and said, oh, this person that we got stool from, that may be a correlation there, which we've also seen in mouse studies as well, that we've been able to transplant from a lean to an obese and be able to change weight, and also the other way around. So that's the thing that, now all the stool has to go through like one major screen through kind of a central center. And it's like it's easier to get into Harvard than it is to get your stool like accepted by this group to be able to be used. Like, you have to be pristine stool, you have to be a certain BMI, no Medicaid, like no, all of these requirements you have to meet. So I think fecal transplant is one of those things that once we learn more about the microbiome itself, the different strains, like what strains are associated with more particular gut health or being lean versus obese. And we know a little about diversity and like certain strains, but not enough yet to generalize. I think the more we'll learn that, the more we'll be able to pick like super donors and to understand like in more of a precise way of like how to utilize it and kind of like more broad kind of applications. So I think that science is actually quite interesting when we see, because we know there are microbiome changes after people kind of eat certain plant-based diets for a week or Mediterranean diets. We can see a diversity increase, and we know that it can right back to what it was before if you resume your old diet. So we do have a lot of people that come in asking for a fecal transplant for, inflammatory bowel disease or, obesity, or just for their gut health, or these like colloquial things they hear online about, what do they always ask about? Leaky gut, which is not a technical kind of GI term that we necessarily use or can be diagnosed, but people see it online all the time. They're like, can I have a fecal transplant to, change my microbiome? And this answer is still the same. There's still no, silver bullet that, changes everything, because I can give you this wonderful microbiome if we have it and do a fecal transplant. And still, if you go back to your same old habits of Coca-Colas and Doritos and foods that you pop in the microwave, then you go right back to the microbiome you had prior. So it's still, same old answer from before, that no, there's no easy way. It's all about lifestyle and diet changes and improving that diet.
Yeah. I'd like to meet the person who invented the fecal transplant or anything. Like, you're sitting around thinking like, boy, that'd be a great idea. Take somebody's poop, give it to somebody else. And as a chef, I'm not going to be able to get that blender image out of my head. Let me tell you, next time I blend, I'm like, oh my God, that's hilarious. Yeah. Could you talk about the correlation between meat and colon cancer?
Oh, yeah, that's a good one. So there are several correlations. One is that we found with definitely red meats, there's an increased correlation in polyps, and then polyps turning into colon cancer. And then also we found through the thing we talked about earlier with TAMO, we've seen that production has led to kind of increased incidences of colon cancer as well. So we don't really know exactly kind of what it is in the meats in particular or why we have this incidence, but we know it because, especially with red meat. So people ask all the time, what should I eat? But the World Health Organization has definitely found that red meats in particular, and processed meats. So people, the bacons, the sausages, hot dogs, like all of these processed meats are more carcinogenic than, other foods. And so those are, and in particular, more carcinogenic and increased risk of colon cancer with those foods.
Great, thank you. So, Dr. Laster, what is the truth about GI health?
Ooh, the question of the century, the question about GI health. Um, GI health is related to, if I can get everybody to understand, it's related to overall health. GI health is central to overall health. And what you put in your body is directly correlated with your health and with your GI health. And so getting patients to eat a more whole food diet, a whole food plant-based diet, getting more diversity of foods, a diversity of fruits and vegetables, drinking more water. These are things that are going to improve your gut health and thereby your microbiome and thereby your interactions with, with fiber and the gut brain axis with your short chain fatty acids and decrease that incidence of metabolic syndrome. And so there's only upsides from improving your diet. And therefore, by increasing your overall health and your state of mind and your quality of life, and just feeling better overall and feeling less lethargic, in decreasing that level of kind of depression and anxiety, especially even surrounding those, physical symptoms and how they manifest with abdominal pain or distension or constipation. So I think gut health is really paramount and kind of the centerpiece of kind of what kind of keeps us together. And what's paramount to that is whether we don't talk about it, no one says it, but what you put in is the biggest factor of kind of your gut health and keeping you safe and healthy. So I think that is the biggest take home for me is making sure you pay attention to what you put in because that's so important. And trying to get rid of those processed foods, drink more water, move more, just move. Moving more, being more mindful, meditation is going to be the most helpful thing you can do for your gut health.
Terrific. Thank you so much, Dr. Laster.
Thank you so much for having me. This was a good talk. I love it.